My name is Martin Birchall. I'm a professor of laryngology at University College Hospitals and University College London. Laryngology is that part of ear, nose and throat surgery that looks at the voice box. It deals with voice and swallowing and breathing. I decided to become a doctor because I guess I was heavily influenced by the television as I was growing up and the kind of things I read. I was fascinated by science fiction, and also as I got into my teens, there's a program on telly called MASH, which was about, an ostensibly exciting surgical experience. And I guess, I wanted to help people as well and kind of introduce the science side of things and put all those together, really. So I ended up becoming an academic surgeon. When I finished medical school, I initially wanted to do urology, which is the waterworks side of things, but the only house job I could get at the time with urology in it actually was a combination of urology and ENT, so ear, nose and throat. And actually I enjoyed the ENT side far more. And there's clearly so much more scope for research into ENT as well. I mean, not that there isn't in all medical specialties, but, a specialty that covers everything from tiny little ear surgery and the intricacies of the way the hearing nerves work through to major head and neck cancer surgery. It just presented so many opportunities. So I was born in South Lancashire in a place called Billinge, which is a little village between Wigan and St Helens. But I went to school in Liverpool, in fact. So I'm kind of a hybrid Lancastrian Liverpudlian. There are lots of aspects of my post which I find very rewarding. I think I'm very privileged indeed, actually, and not only being a doctor, but being an academic doctor, where I have half of my week where I can be researching into the causes and new treatments for difficult throat problems. And in the other half, I get to actually treat patients and apply the results of some of that research. It's an incredible privilege. I think it's a vocation, and I just really love being able to apply whatever is the latest treatments to the problems that I'm faced with in the clinic. I'm not sure what all of my patients value most about me. I would like to think that I'm able to give them a lot more time than a lot of other doctors. Again, I'm very privileged in that sense, in a world where doctors usually have such little time to give to each individual patient. But I do always insist on having extended periods where I can particularly listen and listen to the whole story about the patient and take on board who they are. So I hope patients appreciate that I take the time to really get into what's troubling them and just what sort of a person is around this medical problem. They're not just a medical problem, they're actually the whole person. So I like to think that, and hopefully they see that because I tend to I see a lot of people who've seen other doctors previously. I think it's what happens if you end up being called professor. I think you end up seeing the more difficult ones that have been around the houses a little bit, and hopefully I'm able to offer something that the previous doctors didn't, simply because I'm so super specialised. If I had to choose 3 adjectives to describe my profession, certainly the specialty that I'm in, I would say vocational, absolutely. It's something that you go into because you feel passionate about it and want to help people about it. It's innovative. So I'm, again, very privileged to be in not only part of medicine, but part of ENT that is constantly introducing new ideas, new ways of thinking, and new technologies. So very innovative. And also it's kind of rehumanizing. It's very personal. The problems that I deal with are those things which make us human. That's to do with the voice, the way we present ourselves to the world. It's to do with eating, which is such a fundamental human function, and to do with smell, taste, swallowing, kissing, all of these things that make us human beings. So it's all of that.